The Jacobi Medallion represents Mount Sinai's long and rich tradition of excellence. For over 7 decades, Mount Sinai has awarded the medallion each year to honor colleagues for their distinguished achievements. This year's honorees include Meg Rosenblatt, an expert anesthesiologist who was the first physician to successfully treat local anesthetic systemic toxicity using an intravascular lipid emulsion. Ken Rosenzweig, an internationally recognized leader in the treatment of lung cancer and other thoracic malignancies, and Mone Zaidi, an influential physician-scientist who has made numerous discoveries on mechanisms of skeletal homeostasis in health and disease. These Jacobi recipients are exceptional physicians and visionary researchers. They embody the aspirations of Mount Sinai to advance science and medicine in the name of better and more effective healthcare. Congratulations to the 2026 Jacobi Medallion Award recipients.
When I was a young attending, the chair of the department offered me 2 phrases of wisdom that I've kept with me for my entire career. The first was, you need to find your own pathway to success. The second was, he said, how can I help you get there? And I have used that phrase to this day because if somebody doesn't get somewhere, it gives us a stepping off point to continue to help that person work towards their goal. That shows concern, inspiration, and love for the person you're mentoring. In my Sinai career, I taught residents. I brought ultrasound-guided regional anesthesia to Mount Sinai and developed the Division of Orthopedic and Regional Anesthesia. When I started doing regional anesthesia, it was essentially a blind procedure using local anesthetics to block neural transmission. Bringing ultrasound into the practice of regional anesthesia was a terrific game changer. It allowed us actually to see where the nerves were and how the local anesthesia bathed the nerve. So not only was it much easier to use, there were fewer complications, so patients can get up and go home as soon as surgery's over.
She's taken something that was somewhat experimental and had to be done by really super experts into something that is now routine at Mount Sinai and really across the country. It's really pretty remarkable.
If I were asked to tell the story of Meg Rosenblatt, it would be testimonials of the thousands of people that she's mentored through her life. Working in academic medicine, all of us are called upon to be educators and to some extent mentors. For some people, that's a necessity that they sometimes begrudgingly fulfill. For Meg Rosenblatt, I think that's everything.
My style of leadership is totally maternal. I really care about my residents and my attendings. I want them to succeed, and I think they know that I will do everything within my power to help them get where they want to go.
She has a rare talent for understanding the different roles in medicine people can fill, and early on having an intuition about what each person has to offer. I would not be the person I am today without Meg Rosenblatt.
When I heard that I got the Jacobi, I couldn't believe that I was being honored in this fashion.
Dr. Rosenblatt exemplifies excellence in clinical care as well as service, education, innovation, and research. She is really what the Jacobi Award is all about.
Anytime anybody I've touched writes a paper, gives a lecture, gets promoted, it's my win, and I win all the time. I am the luckiest person in academics anywhere.
When I was recruited here 16 years ago, I saw that Mount Sinai was making an extraordinary investment in cancer, and I was very excited to be part of it. They had me at hello. The opportunity to build my own department, to put my own imprint on it was just really once in a lifetime, and I was thrilled to be able to come aboard. 30 years ago, radiation oncology was not a very well-known field. The nature of cancer care, the first thing people think of is, of course, chemotherapy and other systemic therapies. But radiation has a role in about half the patients who have cancer.
Ken is being recognized with the Jacobi Medallion for having transformed the field and pushed the boundary of radiation therapy.
He's developed protocols that have been nationally accepted to improve the survival from early and late stage lung cancer and have reduced the complication rate and the recovery time for patients who undergo this treatment.
When I was working to grow the research portfolio here, I thought it was very important to take a broad approach to it, developing the standard of care in a number of cancers that we treat: prostate cancer, liver cancer, pancreatic cancer, breast cancer.
That treatment paradigm has set the standard for patients being treated for cancer around the country.
Ken and I realized that radiation therapy was enhancing immune response against cancer. So we decided that we were going to build a program to understand how we can best combine radiation therapy and immunotherapy strategies.
Which tumors are going to respond to the combination of radiation and immunotherapy? What's inherent in a tumor that might make it more responsive or less responsive? And how we can develop synergies between radiation therapy and immunotherapy to improve cancer care and decrease side effects.
This collaboration with Ken Rosenzweig really led to the development of novel therapeutic modality for the treatment of cancer that would not have happened without Ken's vision.
Ken Rosenzweig is really deserving of the Mount Sinai Jacobi Award. Ken is a great physician. He's an incredible clinical investigator. He's an incredible educator, helping to develop the next generation of radiation therapists. And he's a great administrator.
I'm very proud I'm the first radiation oncologist to be awarded the Jacobi Medallion. To get the recognition from Mount Sinai, it's a real badge of honor for the department. Mount Sinai is the place where I spent the best years of my life, and I've devoted my career as a physician to caring for patients. And I'm just so happy I've been able to be here at Mount Sinai doing that, because I feel like it really does make a difference.
Great science starts with thinking out of the box, going beyond your level of comfort to be able to discuss those ideas with people who know more about it. Our institute is an open space where we break through silos, collaborate with other people who do different things, and come up with thoughts and ideas, which then leads to new discoveries, which then leads to new drugs.
What was the key element of those who were giants at Mount Sinai? Yes, their medical abilities were great, often their science was great, but they had the ability to build groups and teams that would go on. And that's what Mone Zaidi's done. His institute is a major force at our institution for pursuing translational medicine and therapeutics and pharmacology. An institute bringing in people from different areas to work on different diseases and looking at different possibilities.
The new Institute of Translational Medicine and Pharmacology is all about drug discovery and early and late stage preclinical drug development. All the research has to be focused with the ultimate goal of bringing therapies to patients. There are 3 areas that are on the top of our list. One of them is Alzheimer's disease, understanding how the disease occurs and creating new therapeutics. The second is obesity. What we're trying to do is to target the fat cell itself with new drugs that allows fat to be burnt as opposed to eating less. And the third area is osteoporosis, where we continue to identify new targets, to unravel new mechanisms.
By honoring Dr. Zaidi, we're honoring an individual who exemplifies the very best of translational science, who's one of the leaders of translational medicine here at Sinai.
We're very fortunate to have him at Mount Sinai, and I believe he and his group are going to make great advances going forward.
What's unique about Mone is his way of seeing that healthcare should never be without asking new questions for science to tackle. And science should never be without healthcare to maintain relevance for the scientific pursuit.
To be added on to the most distinguished people that Mount Sinai has and has been awarded this honor was truly humbling. Mount Sinai has given me, over the last 27 years, a platform which has enabled me to be successful. Mount Sinai means to me a home.